Hi everyone, this is the body care segment on Health Monitor and I'm your faithful host Joan. Today we'll be talking about prostate cancer. As I've always said, I'm not alone in the studio. We have a wonderful doctor here with us and we're going to go on a quick short break, and when we come back, he'll be the one to introduce himself and then we'll go straight into prostate cancer, because as you do know, I am not a health practitioner, so I really don't know much. All I know is that I'm a vehicle through Health Monitor whereby we give health information to you, our lovely audience. Stick around. This is still the body care segment on Health Monitor. Do not go anywhere. We'll be right back.
Health Monitor, your guide to good health. It's Health Monitor, number one health service.
Welcome back. This is still the body care segment on Health Monitor, and we are here live talking about prostate cancer. But before we go into understanding prostate cancer and dissecting it so that we, get into the different parts of prostate cancer, Dr. Daniel, first of all, I'd like to thank you for making it on the Health Monitor show. Thank you so much. Now, the floor is yours. Please do us the great justice of introducing yourself.
Okay, thank you, John, for having me here on your show. I am Laifa Daniel, a graduate of medicine and surgery for the prestigious University of Lagos. It will be a nice time talking about prostate cancer. It's quite common amongst men. Thank you so much once again for having me on your show.
Thank you so much. Thank you so much. We appreciate you. Thank God that you were born to be a doctor. Because we need more amazing doctors like you. But you did say that prostate cancer is very common amongst Nigerian men.
Yes.
But before we even talk about how common it is in Nigerian men, we would like to understand in the most simple form, what is prostate cancer?
Okay, thank you for that question. So when you're talking about cancer on its own, cancer is an abnormal growth of cell, whatever region it is. And the prostate gland is more like a walnut structure located between the bladder and also between the bladder and the rectum. That's like the anal canal.
Yeah.
So it's a walnut structure. And what's the function of the prostate? It releases fluid that helps the semen to be alive. So if there's a cancer of the prostate, what that means is that there's an abnormal growth, abnormal cell division within that structure I just described.
So would it affect the fertility of a man?
Yes, it can.
I never knew that. Okay, so why does it affect men as they advance in age?
Okay, that's a very good question. So as cancer generally will be, cancer just has to do with cell division.
Yeah.
There's a problem with cell division. As you age, the problem increases, or the problems increase in terms of cell division. Also, as men age, the prostate gland also become enlarged. And because it's getting enlarged, the tendency for the cancer to be predominant is also there. So that's why it affects men as they grow.
So is it normal for it to just be enlarged as they advance in age? Is that normal?
Not all men will have enlarged prostates. Sometimes there are other underlying factors which we'll talk about in the course of the discussion that can tilt a man to having prostate cancer.
Wow, so now how common is prostate cancer amongst Nigerian men?
To shock you, prostate cancer is the most common cancer amongst Nigerian men. If you take all the cancers among Nigerian men, you bring them somewhere, 30% out of the 100 are prostate cancer.
30%?
30%, yes.
I would think that probably lung cancer.
Prostate cancer is number one.
Wow.
Amongst Nigerian men.
Are there genetic or lifestyle factors that actually make Nigerian men very susceptible to prostate cancer?
Okay, that's a very good question. So I'll start with the lifestyle factor.
Yeah.
So there are quite a number of lifestyle factors that can cause men to have prostate cancer.
Yeah.
Those who indulge themselves in saturated meals.
When you say saturated meals,
I will give you examples. Examples of meals that are high in fat. So we have things like butter, things like cheese. However, those ones they should possibly be down the list.
Yeah.
Things like chicken, taking the covering of the chicken. Yeah, they are
Chicken.
yes, chicken, turkey covering. They are very high in fat.
The skin.
Thank you. The covering, the skin. Pork. Yeah, also high. Lard, they are high. Even fat dairy products are also very high in saturated meat. Also, red meat too can also tilt men to having prostate cancer. Obesity too can also. Physical inactivity can also make men have prostate cancer. Yes.
Wow, everything you've mentioned, like oil, right?
Oil, yes.
Oil.
Yes, oil.
This is embedded in our Nigerian diet.
Yes, they are. They are.
Chicken.
Chicken, turkey.
I see a lot of men eat turkey and
Yes,
chicken.
Yes.
So, orobo chicken.
Oh, yes.
Dr. Daniel goes, oh, yes.
Yes.
Wow. So, at what age should Nigerian men start paying? Wait, you're not done answering the question. No?
Okay, genetics. Yes. So, genetics too also play a role. Genetics in the sense that if you have 3 or even less than 3, 1 to 3 of your family member within the nuclear family, your father or your father or your uncle, any of them they have any of them are prostate cancer, there's a tendency for you to have. And also if 1 out of the 3 generations you stemmed out for has prostate cancer, there's high chance to you have. So genetic really plays a role in prostate cancer.
What if there's somebody in the family that probably didn't, let's say the mother has lung cancer.
Okay.
Is the man still susceptible to prostate cancer?
No.
Or does he have to be if there's one particular person in the lineage that has prostate cancer?
Okay, it has to do with like one person in the lineage. Yes. And also for women, if you have a mother who has breast cancer, the scientists have shown us that breast cancer too has a link to prostate cancer. So those genetic mutations, genetic distortions and disturbance too can also tilt an individual, a male, to having prostate cancer.
We have we've settled that as men advance in age, they're susceptible to prostate cancer. At what age would you say Nigerian men should start paying attention to prostate cancer?
Okay, so at age 40.
Okay.
At age 40. However, if you don't have all those risk factors we mentioned, especially the genetics, you can start paying attention at age 50. Yeah, but generally age 40 is safe.
40. Not even like 35?
No, 40 to 45, yeah, safe.
40 to 45, okay. Now, what are the common lifestyle habits that can reduce, because you've let us know of the lifestyle habits that can tilt a man. You said saturated foods, right?
Yeah.
Now, what lifestyle habits can shift a man away from prostate?
Thank you for that question. That's a lovely question. So it's just opposite of what I've said. Anyways, any man who doesn't want to have it has to reduce saturated milk, fats, pork, cheese, milk, chicken covering, and all those things. Number 2 has to increase intake of fruits and vegetables and water. They are very important. Exercise, as you rightly said, you have to do exercise at least 30 minutes a day. At least exercise 30 minutes a day. Then you also have to sometimes, even if your jobs require you to sit down all the time, so now just stand up and take a walk. Avoid sedentary lifestyle. So those things can also shift you away from having prostate cancer.
Now, you have mentioned that family history is a strong factor.
Yes.
So what are the early signs, warning signs that a man in his 40s to 50s should look out for where prostate cancer is concerned?
So prostate cancer, they have issues as regards frequency. Normally in a day you shouldn't urinate more than twice, but if you as a man you see yourself urinating frequently, more than 5 times a day, there could be an issue. That's frequency.
Wait, sorry, can you
say that again?
Yeah.
So you shouldn't urinate more than twice a day.
For a man?
For a man. Let's raise it up a bit, maybe 3 times.
What if he has...
Excessive, it takes water a lot. Yeah, if he doesn't take water a lot, he's able to measure his water. He doesn't take water a lot, and he sees himself going to the toilet. He's sitting with his friend. I want to pee. He sits again with his friend. 30 minutes. I want to pee, and it's coming frequently. That's a warning sign. Also, for frequency, we can say frequency also at night. We call it nocturia in the medical term. You're urinating frequently, and at least you should urinate once or twice at night. But if you're urinating, waking up at night 3 times, 4 times, because it's a warning sign. Number 3, urgency. So what does urgency mean? Urgency means, for instance, you're watching your favorite show, and you want to pee. At the same time, you can still restrain yourself from going to the toilet to pee. So, but for urgency, or someone who has issues with the prostate, he finds it difficult to hold or restrain himself from peeing, even while watching his favorite movie or his favorite TV show, and he goes to urinate. Urgency. Then we have what we call weak stream. The urine should have a force. Or if you see your urine is not having a force or a direction, there could be some issues with the prostate. So incontinence, you pee on your body. So this could be as a result. There could be a prostate issue going on. We could have what we call dribbling. After you're done with urinating, you just see that it's coming out slowly, small bits. And then we have what we call incomplete voiding. You see, you urinated, but still you feel your bladder is still not fully emptied. So those are the cardinal things that you can see, symptoms that you can see that can tell you that.
So from everything you've described, it feels like 80% of the early signs and symptoms has to do with bladder.
Yes, because the prostate and bladder are interconnected. Yeah, so it's more like compressing on the bladder. Yes, and creating an obstruction and also an enlargement. Yes.
So the enlargement is what is pressing against.
It's pressing against the bladder, and it can create 2 types of symptoms: broad symptoms and irritative symptoms, or obstructive symptoms. And the obstructive symptom is when you have those incontinence, you are having a sort of obstruction, and it can create an irritative symptom. Irritative is the little urine you have left, you are easily irritated, and you pee frequently. You go to pee frequently during the daytime and at night too, and you have also some form of urgency too.
Wow, let's go on a quick short break. When we come back, we're still going to be talking about some signs and symptoms of prostate cancer in men. Do not go anywhere. This is still the body care segment on Health Monitor. We'll be right back.
Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
Welcome back. This is still Body Care on Health Monitor, and we're still talking about prostate cancer. Before we went on a short break, we've understood what prostate cancer is, the people that are the men that are susceptible to prostate cancer, and how lifestyle and genetics affect, or rather are factors of prostate cancer. And before we went on this short break, we were just talking about the symptoms. And Dr. Daniel, from everything you described, it feels like you said, a description of prostate.
Yes.
It's kind of like they work together, the prostate and the bladder.
Yes,
so
they do.
It seems like 80% of symptoms have to do with inconsistencies in the bladder.
Exactly.
Wow. Now, I want to ask a very important question, because I did some research, and I realized that based on the research I did, a lot of men shy away from going to the hospital compared to women. Now, it's leading to this question: why do men discover prostate cancer late, and how can we change this trend?
This is a very correct narrative. Possibly because of the masculinity, a lot of men they feel they are very strong, they don't need help. That can be one.
Fair.
Number 2 is awareness. Awareness is very poor. Very few people, although I think we're getting quite enlightened in this modern era, as regards prostate cancer, as regards those things. And a lot of men fear that they might have it, and they don't want to go through that route of having to do investigations and all those things. And people, they are being, let me say, I put stigmatized in quotes, and people are watching, this man has prostate cancer and all that. Then number 4, poverty, ignorance. They are like brothers and sisters. So because some people can't afford it, even going to check for it, they have those things coming up, but they can't afford to even go to the hospital for even a common prostate specific antigen test.
Wow. So at the end of the day, strength is not informing bad guy.
Yes.
Yeah, strength is actually in understanding your status.
Yes, exactly.
And working towards it.
Yes.
And I don't know why there would be a stigma towards that.
There could be people
is it the ego?
I know. I think people who have chronic diseases, especially things like cancer, you hear someone has cancer, people might say, you have cancer. possibly some people think cancer can also be transmitted too. So
Come
there's a whole lot
on.
of awareness gap.
Yeah,
Awareness,
true.
miscommunication, misconceptions as regards all things like this.
Wow. So now we're going to talk about the age-related, the difference between normal age-related prostate enlargement and cancer. You remember when you were talking, warming us up to what prostate cancer is, you did say that as men age,
Yes.
the prostate is enlarged.
Yes.
And I asked you, is it normal for it to be enlarged? You said there might be underlying
Yes.
factors.
Yes.
Now, what is the difference between normal age-related prostate enlargement and cancer?
Okay, as I said, not all men, as they age, we have enlarged prostate.
Yes.
So a precursor or a precursor to prostate cancer is what we call BPE or BPH. That's benign prostate hypertrophy or benign prostate enlargement. That means when you check using your hand, what we call a digital rectal examination, and you feel the prostate, you can see some form of enlargement. You can see that it's bigger than it should be. So if such person has that, all those symptoms have outlined before will be there. However, for prostate cancer, most times, especially if it has spread, most times, or if it is regionalized around the regions, you could have some form of other complaint aside those frequency I had mentioned, things like back pain, lower back pain, because it could have gone to your bones, could have spread to the bones. You could have some form of what we call fecal incontinence. That means you're just like the way you can pee like involuntarily, you can also poo involuntarily. So it could have gone to your rectum because the prostate is just in front of the rectum. So those ones. So I wouldn't want to say normal prostate enlargement, because there's some people that some people who are aging and they don't have prostate enlargement. However, the precursor in some people who precursor for prostate cancer is called benign prostate hypertrophy. Some people might have that, but they won't have those other symptoms of spread to other parts, maybe lower back pain or fecal incontinence, or they are having other issues with their kidney, because sometimes when the cancer become a bit advanced, it can affect the kidney also. So those are like the difference. The difference is that for the cancer it can affect other organs, while for the benign prostate enlargement or hypertrophy, it won't affect other. It's just localized to the bladder and the prostate region.
Your guide to good health. It's Health Monitor, the #1 health